While many parts of the economy are in a deep freeze, sales at the LCBO, well, they're way up. Same at breweries and wineries that sell direct to the public. That may be a good business story, but is it good for society? For some perspective on imbibing during a crisis, we're joined in Sherbrooke, Quebec by Catherine Paradis, Senior Research and Policy Analyst for the Canadian Centre on Substance Use and Addiction, and in our nation's capital, Rod Phillips, Professor of History at Carleton University, and we hasten to add, no, not that Rod Phillips, the Finance Minister. This is Rod Phillips, the Professor in History. Nice to have you both on our program tonight. Catherine, you did a poll to find out whether people's drinking habits have changed much since the start of the quarantine. What'd you find out?
Well, we did find that most people kept their normal drinking habits, so which is good news. But we're a little bit concerned about 20% of Canadians, 18 to be precise, who reported to drink more than they used to since the onset of the pandemic.
Did they explain why they're drinking more?
Yes, they did. So the vast majority of them said that they were drinking more because of a lack of a regular schedule. We're all at home now, and a Tuesday may look like a Saturday or vice versa. So lack of regular schedule definitely seems to be a reason. That being said, there were significant gender differences there. And women were much more likely to cite stress and anxiety as their main reason for increasing their alcohol consumption, while men cited loneliness and boredom as the main reason for drinking more.
Interesting. Rod, what do you make of those results?
Well, I don't think they're really surprising. I mean, a lot of people drink. I mean, most Canadians drink occasionally or regularly, and it's part of the fabric of everyday life. And I think people are trying to establish a kind of normality within a broader abnormality, and having a drink is part of that. And it doesn't surprise me that under unusual circumstances, some people at least would drink more.
If I've heard it once, I've heard it 100 times over the last 7 weeks, that people, who you talk to, who you email with, Catherine's right. They have no idea if it's Tuesday or Thursday or Saturday. All the days seem to blend into one another and feel the same. Do you think that makes sense for accounting as to why people are drinking more these days?
I mean, I think that's right. Certainly there's no sense of a weekend. People who are working at home and keep a schedule have a sense of a weekdays and weekend days. But I think most of us wake up in the morning and wonder what day it is. And even during the day, what time it is. I mean, we have this notion that you shouldn't drink before, well, it depends who you're talking to. You shouldn't drink before 5 or 6 or 4. But if you're not really sure what time of the day it is, I mean, you might start drinking a little earlier or later.
Mm-hmm. Catherine, are the people who are drinking more now the same people who might always have issues with overconsumption when things get stressful in their lives?
We don't have the reason to that. It might be, but it's definitely something we're curious about. And so just last week, we started a national survey. We went into the field with about 40 questions to Canadians regarding their patterns of alcohol use, and trying to find a little bit more about the possible explanatory mechanisms behind what's happening right now, why they might be drinking more. So it will be very interesting to see who is most vulnerable. But what we know also from previous studies that I've looked at alcohol consumption during a time of crisis is that for most people, we tend to observe, in fact, a decrease in alcohol consumption. Those who increase are the most vulnerable ones. Those who already had mental health issues or were unemployed or had financial difficulties. So this is really a group that we need to pay attention to.
Now, the World Health Organization, of course, has had a lot to say about how to treat the pandemic, but they also have recommendations, and these are out of their European regional office, on drinking during a pandemic. And I'll just read these out for you, and you can tell us what you think. Avoid alcohol altogether, they say, so that you do not undermine your own immune system. They suggest you avoid alcohol as a social cue for smoking and vice versa. The WHO says make sure that children and young people do not have access to alcohol and do not let them see you consume alcohol. Be a role model. They also suggest that you should monitor the screen time of your children to avoid harmful misinformation that may stimulate early initiation and increased consumption of alcohol. So, Rod, the WHO seems pretty down on alcohol. What do you think of those guidelines?
Yeah, they are pretty down on alcohol, and I think those might be in broad terms quite good ideas, but at the same time, it does seem to treat alcohol consumption as pathological, doesn't it? I mean, this idea that you shouldn't drink in front of children suggests that you should secretly drink away from children, that your children shouldn't see you drinking. If you're drinking on a so-called what I think of as a normal basis, you're having a beer in the evening or a glass of wine with dinner, there's no reason why children shouldn't see that. This is treating alcohol in a responsible sort of way. Certainly, if you're drinking to the point of getting drunk, it'd be a very bad idea to let your children see that. But alcohol has become part of the texture of our lives. It has been for centuries, and I think there has to be some recognition of that too.
Well, you know the history of this stuff and the attempts at prohibition and so on in both the United States and Canada. What seem to be the consequences of telling people not to drink over time?
Well, the consequences are fairly predictable. And in the United States and in Russia, which had prohibition for a long time, the consequences were simply that the black market took over what had been the open market. People drank, by the end of Prohibition, people were probably drinking as much alcohol as they were before Prohibition. And it had, various negative consequences, as we know. So that, shutting off supplies of alcohol would do harm to some people who need alcohol, physically need alcohol. And I think it would do harm to people who consume alcohol responsibly, in the sense that it would add another level of abnormality to what is already a very tough set of conditions that people live in.
Catherine, it's just occurred to me at this point that I probably should be calling you Catherine as opposed to Catherine. Would you prefer that?
That's fine. I'm used to both ways of pronouncing my names.
Well, I think I should probably pronounce it the proper way, given that you're in Quebec. So, okay, Catherine, let's follow up on this. What do you think of the WHO's advisability of telling people that their best bet during a pandemic is not to drink at all?
Well, I think it's a little bit unreasonable. We can, of course, advise it and hope that some people might use this pandemic to revisit their drinking, a little bit like we do during Dry January, where we ask people for 1 month to experience what it would be, what their life would be without drinking. And so in that sense, it's why not? That being said, and of course, I read through the whole WHO document, and there were very good advices there. But when I read the one about avoiding alcohol cues and triggers on TV and media where there is pervasive marketing and promotion of alcohol, I had to laugh a little bit, because in Canada, given the extent to which we publicize and advertise alcohol, I was wondering how that would be possible to avoid altogether. It's everywhere on social media, but even on television. So I felt that one was probably not culturally applicable to Canada.
Mm-hmm. Let me follow up on the dry Januaries with you. My suspicion is people can handle a dry January because they probably overdid it during Christmas parties in December, and they understand that January eventually will come to an end. And February will come. I guess we're in the middle of a pandemic and no one knows when the ending is going to be. So to tell people they ought not to drink during the entire length of this pandemic is basically telling people to stop drinking for a year or two or more. Does that sound reasonable to you?
Well, at the Canadian Centre on Substance Use and Addiction, what we've been advising folks since the beginning of the pandemic is to, if they do drink, to stick to Canada's low-risk drinking guidelines. Women should never have more than 2 drinks per day, men should never have more than 3, and also try to stick to the weekly limits also of 10 for women and 15 for men. It's important. We talked about it before. In a context where we don't really know where weekdays end and where weekends begin. Just perhaps to keep track of the number of drinks you consume weekly would be a good idea. And we have several resources on our websites to help you do that if you would wish to.
Now, Rod, it seems to me that the government of Ontario has spent and offered tax cuts to the tune of $17 billion over the last few weeks to fight this COVID-19 situation. And one of the streams of revenue that they truly depend on are alcohol sales. Can you imagine in the midst of this pandemic, as the government is trying to squeeze every nickel out of the economy it can for what little of the economy is left, can you imagine them encouraging people to stop drinking and forego those revenues as well?
Oh, I really can't. And this government, the Conservative government in Ontario, has been a very alcohol-friendly government right from the beginning, when it encouraged breweries to produce bucket beer and extended the hours at the LCBO and so on. So it's very unlikely that this government, in particular, would urge people to stop drinking. Which is not to say that they encourage alcohol abuse. But the revenues from alcohol are really substantial, and they always have been. It's one of the reasons that the Americans abandoned prohibition, was that by the end of prohibition in the early 1930s, the Depression had taken hold, and they needed money for the big public works programs under Roosevelt, and they needed the alcohol revenue. So that was the end of prohibition, and exactly the same in Russia, where Stalin actually said, we have to make vodka to get the taxes so that we can industrialize. It's pretty important.
Catherine, let's just understand the main issue here, I guess, which is, if people are drinking more, is that necessarily a bad thing? What's your view?
I mean, if they're drinking more frequently, if instead of just having a glass of wine on Friday and Saturday, they're now doing that 3-4 times a week. Again, if they drink within the lowest drinking guidelines, that's probably not a problem. What we're concerned with, though, is that the most vulnerable population might start drinking much, much more. It might be hard to go back to their previous patterns of use after the pandemic, because let's not forget that alcohol is a very addictive, psychoactive substance. And as you mentioned before, we don't know how long this pandemic will go on. So people who were used to drinking 2 days a week will start drinking 5-6 days a week now for who knows how long, might find it difficult to go back to their previous patterns of use. And of course, the big concern we have at the moment is those who drink too much. If they are in household dynamics where there is violence, we're definitely concerned about the impact this might have on increased domestic violence.
Yeah, Rod, nobody wants to see anybody drink to excess, obviously, and certainly not to drink to the point where they lose control and foment a more violent household. Nobody wants to see that. But if to ride out this pandemic and sort of, what's the expression people use, take the edge off, they have 2 glasses of wine over dinner instead of 1. Is that necessarily a bad thing?
Well, I don't think it's necessarily a bad thing, but this is the problem that policymakers have dealt with for centuries. I mean, you go back 2,000 years, 3,000 years, and they're talking about the number of people the small number of people who abuse alcohol, mainly beer and wine at that time. And there's always concern about getting control over the relatively small number of people who can't drink responsibly. And that was one of the reasons for prohibition in the first place. And that is that instead of trying to control the small minority, the answer was simply to deprive the whole population of alcohol. And here we are today in the same situation. I mean, there are people who think that liquor stores should close during this period because it will be abused by some people. Now, I think that would be a very bad idea, but it's one of the ideas that was floated several weeks ago.
Well, Catherine, the fact of the matter is, several weeks ago, the province of Ontario did put out a list of, say, 70 some odd businesses, which it called essential to getting through the pandemic. And the Liquor Control Board of Ontario, the monopoly that essentially, or quasi-monopoly, I guess, that essentially sells the vast majority of the spirits and booze in this province, was on that list. It is considered an essential service. Do you think it is?
Well, what we did is that we looked at the literature, and of course, there's no black and white on this. In science, we're always in the world of gray. There are definitely risks associated with keeping them open. We've talked about some of them: increased alcohol use for some vulnerable population, increased domestic violence, and also we talked about the revenues that alcohol bring, but in the long term, there are also costs. Let's not forget that annually alcohol costs Canadians $14.6 billion. So if many people drink more during this pandemic, we can expect some cost. That being said, there would have definitely been risk also with closing the liquor stores during the pandemic. Increased anxiety and stress and the loss of some sort of normalcy would have been one risk. Involuntary alcohol withdrawal would be another important one. And of course, a loss of short-term revenue at a time where our governments will definitely need money.
Now, if you were the Premier Ministre de Province de l'Ontario, would you have made alcohol sales essential and allowed the stores to stay open, or would you have closed them?
That is why I never attempted to become Prime Minister of any province in North Canada. And in the position I am now, I can just say I will not answer that question.
Catherine, that was a very elegant dodge. I'm going to let you get away with that. That was a good one. Now, mind you, Rod, take us to South Africa. They did ban alcohol sales during a lockdown there, and what was the result?
The result was not good. I mean, you have a great deal of anxiety. But also, some thefts from liquor stores. I think some trucks were hijacked, carrying alcohol. I think for export. So I mean, there were those consequences, and then all the invisible consequences that we couldn't see. As Catherine says, I mean, there are people who suffer from involuntary alcohol withdrawal. These are serious health consequences for some people. And just a matter of weighing up the pros and cons. I think, part of the problem is the word essential. I mean, what is essential? I mean, here we have grocery stores that are essential, and that makes sense. But think of all the garbage that's available in grocery stores, sugar-rich foods that are bad for you, and that kind of thing. So it's got to be a broad brush approach. And I think keeping liquor stores open was the right move.
Well, having said that, we did have a police officer from York Region on this program a couple of weeks back, I guess. And, he was talking about all the stuff he was seeing in the streets these days. And while drunk driving, of course, still exists, it's down a lot because, of course, many fewer people are driving. And I wonder, Catherine, is that one of the positive things, or might it have been a more positive thing if we'd shut the liquor stores, is that we'd see, fewer people in trauma units in the hospital, less drunk driving. A lot of the negative aspects might not be happening as much. Is that fair to say?
It is fair to say, but even with liquor stores open, we are seeing a decrease in some types of alcohol-related harm. Drinking and driving, people don't go out anymore, so they don't drive. Among youth, acute alcohol intoxication is, of course, something that we know exists. In Sherbrooke, where I live, it's one youth every second day that is admitted to the emergency room for acute alcohol intoxication in normal times. Now, we are monitoring the situation here, and of course, we expect a decrease in that number of young people coming to the emergency room because, well, they don't go out to bars anymore, they don't have parties, they don't see their friends. So we are seeing some decreases in some types of harms.
Rod, let's finish up on this. How do you think this quarantine and the new conditions, I guess, under which people are drinking alcohol will or will not change our relationship with alcohol going forward?
Oh, you always ask a historian about the future. It's I really, it's very hard to know how the whole thing will unfold. But I think you have to see, alcohol consumption in the broader picture of social change following this. And I've really no idea. I mean, I read. I read accounts that say that there are going to be major changes in social relationships, and in other cases, not so much. People may get used to drinking at home more. People may discover that it's a lot cheaper to drink alcohol at home than to go out to bars and restaurants. But the other thing is that people generally like to drink with other people in groups, and drinking alone, which is always something that has been a bit taboo, has become probably much more popular now. So I don't know. I suspect there'll be a number of patterns emerging.
Catherine, last 30 seconds to you. How do you imagine our relationship with alcohol might differ going forward because of new habits created during this pandemic?
Well, I would say more because of governments calling it an essential service. It has brought a lot of attention to the issue. And I would hope that moving forward, because alcohol is no ordinary commodity, our government will pay attention to the issue and move forward implementing effective alcohol policies that we do need in this country.
That's Catherine Paradis from the Canadian Centre on Substance Use and Addiction, and Rod Phillips from Carleton University. We're grateful to the two of you for coming on to TVO tonight. Be safe out there, and thanks so much.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.